Hello everyone, it's Ashley with Amare, owner and founder of Amare Healing Arts, Plastic Surgery Recovery Center, and Holistic Clinic, specializing in manual lymphatic drainage. We have 2 locations in New Jersey, Highland Park and Elizabeth, and I also offer virtual consults. If you're not in New Jersey but still need help with your recovery, you can give the office a call at 732-841-0142 to set up your sessions. We have our post-op shop where we offer post-op supplies like Lipo foams and BBL pillows, and I teach you guys how to use those products with the videos that we have on our product page. That's amarepostopshop.com. We also have our online courses where I teach you guys what massages you would need after plastic surgery, when to get your massages, who to get them from, what the lymphatic system is, what lymphatic massages actually are, and all the research that you would need on your post-op massages and finding a lymphatic therapist. All of these links are in our bio as well as in the description boxes, so you guys can go and check that out. I will see you guys soon. Ashley with Amare. Bye. Hello everyone, it's Ashley with Amare. Hold on, let me adjust the mic. Okay, so guys, hi. We're gonna talk about things today, but this isn't gonna be like my other videos where I like pull up an article and go deep into things. We're gonna talk about your post-op massages. Here's the thing. You guys do research, in quotes, right? Air quotes. Your research consists of Instagrams, TikToks, interwebs, late at night, following other people's My Journey videos, looking up your doctor's name and finding people who've been to that doctor and what they did for Aftercare. You guys are not doing the digging on Google as far as the medical journals research, which is what I do for you guys, right? Because I know it's really frustrating because a lot of people are like, do your research, and then they expect you to go and look up like medical journals and figure out what all this stuff is, like what is swelling, what is the lymphatic system, what is post-op massage, like all this stuff, right? Like they expect you guys to go and find all of this information. Nobody really puts it together in a package for you, like specifically, which is why I do these videos. And you guys always hear like, or you come in and you tell me and you're like, well, they say I need rollers. Well, they say I need to, massage myself. Well, they say I need boards or squeeze massage or getting fluid pushed out of me because that's lymphatic drainage. Guys, who are they? We're going to start this video with who is they? Who are the they that you're talking about? Because the they that you're talking about are the same people that are going through surgery that also didn't do any actual medical research and is just kind of falling prey to all of these things. So a couple things we're going to talk about today as far as post-op massage. Why you need it, what the purpose of it is, where this concept started, why, like how it benefits you, and then what exactly is it? So this whole like post-op massage thing, guys, manual lymphatic drainage existed before plastic surgery was a thing. Manual lymphatic drainage massage, which is what we are talking about today, was created in the 1930s by Dr. Emil Vater, Emil and his wife Estrid. And it was for all conditions that have swelling, not just plastic surgery. So I'm going to say this again. Lymphatic massage, manual lymphatic drainage, was not just created for plastic surgery. It's for cancer patients with lymphedema. It's for autoimmune conditions. It's for chronic sinus problems. It's for any inflammation in the body. It's not just a plastic surgery thing. So when you guys hear lymphatic drainage, which I'm going to do a whole video, this is like the first in a couple of the series that I'm doing about like the massages. I'm going to do a whole video on what lymphatic drainage is because you guys think it's fluid being squeezed out of your body, and that is not how that works. When you stub your toe, your body does lymphatic drainage naturally on its own. Your lymphatic system is draining the swelling back into your body. It is not, I'm cutting myself open and draining fluid. That's not how that works. So when we're talking about post-op massage, you guys see a couple different things. You see cavitation, you see blood and fluid coming out of you, you see wood therapy, you see aggressive rollers, you see lotions and oils with people's hands raking and rubbing and digging. The most common thing is the post-op Miami stuff that's everybody's doing. Just because everybody's doing it does not mean you're doing it, does not mean it's right, does not mean you should be doing it. Again, let's use the tried and true analogy is if someone jumps off a bridge, you're not going to follow them and go jump off a bridge. You're going to use your brain and make sure you don't do the bad things. But again, you guys have nowhere to turn. You have nowhere to look. You have nothing to base it off of. So you're just looking at someone else's results and someone else's body, and you're thinking, oh, well, they did the rollers, the body contouring, the squeeze massage, and they look great and they look amazing, so I'm going to go do that too. That's not guaranteed. That's not going to get you the results you want. Also, you don't know if that person has fibrosis. You don't know what they've been through. You don't know their complications. You don't know how they feel about their results now. You're just going based off of a picture or a video, and that's it. There's nothing to back it. There's no medical science. So this isn't like a put together video. This is me just out here talking to you guys. There's a lot of things that you consider post-op massage. Now, again, there is no one post-op massage. There is no like, oh, I'm going to call a bunch of places, they're going to offer me post-op massage, and it's going to be the same thing that everybody else got. That's not how that works. It's the same thing when you say facelift, how it doesn't just mean one thing. Facelifts can include eyes, can include chin, can include incisions in front and behind the ears and in the forehead. There's a bunch of different things. It's not just one name, and that's what you're getting. It's all kinds of things mixed up into one, which is what makes this so confusing for you guys. So when we're talking about what massages you need after plastic surgery, when we're talking about what actually works and why, we want to be looking for manual lymphatic drainage. Now, this video is going to be so long if I explain all of it. We have a course, how to find a post-op massage therapist and post-op lymphatic massage. So in that course, I talk about all of this, but I take you through it step by step. So we start with what is swelling, where does it come from? Then in module 2, it's what is the lymphatic system, the thing that's responsible for getting rid of your swelling on a regular daily basis. So what is your lymphatic system and how does it work? Because in the post-op world, we hear it all the time. We need lymphatic massage. We need lymphatic drainage. Okay, but what is that? And again, you guys are not going to go down the medical rabbit hole reading medical journals till 3 a.m., understanding doctor speak, understanding what lymphatic drainage is. So I break it down in an entire module and explain it to you guys what the lymphatic system is and how it works, because after surgery it works the same way. You guys treat surgery like it's some other weird like non-medical thing where you're just like, oh, well, I'm just getting surgery done and then I'm going to go get the squeeze massage or the roller because it's, different than everything else. If you had a knee surgery and you have swelling from the knee surgery, you're not going to go get like squeeze massage or use a wooden roller on that. That's not how that works. It's not how the body works. So that's module 2. It explains about all of that. And module 3 is why do we swell so much after surgery? So this is the demystifying the whole surgery part of it, right? Because you guys think surgery is some other weird animal. Plastic surgery is plastic surgery. Whether you're doing it for cosmetic reasons or you got a dog bite and half your face is ripped off and you need plastic surgery, or you have a deviated septum and you need to get your nose fixed, it's plastic surgery. It's still the same. The reason we're doing it may be different. The purpose may be different, but it's still surgery. It's still medical. Your body is still going to react the same way. So treating your body, and I say this in a bunch of my videos, treating your body the same way you would as if you had a medical injury after plastic surgery is the way that we need to go with this, because it is still the same thing happening to your body. Your body doesn't know that you're doing this for cosmetic reasons. Your body doesn't know that this is not it being attacked by a bear or getting into an accident. Your body doesn't know that. It's still going to try to do the same healing path. And I have a whole video on that too. But that's module 3, is why we swell so much after surgery. And hint, hint, it's not the surgery. That's the injury. It's the bad aftercare that you guys are getting. It's the constant abuse to your body that you guys are getting. It's the heat, which is a vasodilator, which will cause more swelling. It's the aggressive rollers that are breaking tissue that's trying to heal. It's the aggressive squeeze massage where all that blood and serous fluid, all that fluid that's coming out of you, your body's trying to use that to heal. And you are pushing that out of you, taking away those valuable resources, and then you're continuing to break the tissue that's trying to heal, causing more swelling, which will then become fibrotic because your body thinks, oh, this keeps getting beat up. We need to make this like harder and thicker and like more, dense because it keeps getting injured. This is where all that confusion comes in with you guys in your research, because no one's telling you that. They're just telling you, I did this and I got snatched. Okay, but why? where's the medical backing? Where's the science that proves that this works? Because if you guys after surgery are going to go through all this torture and then still wind up with fibrosis and swelling and in a faja for 9 months, doesn't really seem like it's worth it. And you're spending money to pay someone to torture you. So in module 3, we talk about like at what point in the healing process after surgery does it go wrong? Like, why do we plateau with our healing? Why do we, like, all of a sudden, like, our swelling comes in and it stops, but then it never goes down? Or, like, it goes down a little bit, but then you, like, hit a wall and you're still swollen the same way. Like, that's what module 3 is about, is talking about, like, why the swelling after surgery. And then module 4 is all about your massages, because we can't talk about lymphatic massage and swelling, like massage for swelling, if we don't know how the swelling works, how it got there, what's causing it to stay there. We can't talk about that until we explain everything else. And that's kind of the point, because my videos that I put up for you guys are 30 minutes, 40 minutes, and they're all different pieces. This course literally is me holding your hand through the entire process and explaining it to you, because you guys don't understand, again, what massages you need post-op. In order to understand what massages you need post-op, you got to understand why you need them. And in order to understand why you need them, you have to understand what's going on in your body first. So those are the first 4 modules. The last module is finding your therapist. And this is also where you guys, with your research on the whole topic of like, what massages do I need post-op? This is where you get in trouble, because you're going to call someone and say, hey, do you offer lymphatic massage? They're going to say yes. You're going to go in and they're rubbing you with oil. They're raking through your body. They're using machines with heat that are causing more swelling and pressure. Yeah, maybe it feels good for like a moment. It maybe feels good for like the massage, and then the next day you're like, God, why am I so swollen? Why am I so tight? Why is this so much harder than it was before? But I need these massages, right? So I gotta keep doing them. No, you don't. No, you don't. Did you ask if that person was licensed? Did you ask if that person was certified? No, because you didn't know what to ask. So in that module, in module 5, I break down all of the letters. The same way you look for letters after a surgeon's name is the same way you look for letters after a like massage therapist licensed manual lymphatic drainage practitioner's name. We also have letters and credentials. If you don't see those letters and credentials after our name, it's most likely they took a weekend education course and not like a full-blown certification. So I teach you guys what to look for so that you know you're getting the right thing. So the next thing with this is, with finding a therapist, if you guys find that person and they have those letters and they have those credentials, but you don't have enough knowledge to make sure that they're doing the right thing for you, it's still not going to end well. You guys, again, back to the whole research thing, you don't know what research to do. You don't know what you're looking for. You guys are getting surgery, and this should be a one and done surgery thing. This shouldn't be, I'm going back for round 2, round 3, round 4 because I didn't know what I was getting or looking for. And you guys always ask me, like, what surgeon do you know that's good, that has good results? What surgeon gives the best BBL? What surgeon gives the best tummy tuck? It's not about that. The surgeon is the artist. Okay, so let's think about this, right? And this is the other reason that this module is so important. Let's think about this. You have a painter painting on a canvas, right? And let's say it's Van Gogh or Picasso, because surgeons are artists, right? So we got a Van Gogh and we got a Picasso. And they painted it and it's beautiful, right? And they just painted it. And within the first like 3 or 4 days, it needs to dry, right? So let's say that's the first 3 or 4 months of your recovery. You give those paintings to 2 different people. One of those people lets it dry, lets it set, lets it do what it needs to do, does whatever needs to be done to cure it, to make sure it sets properly, keeps it in the right conditions, keeps it out of direct sunlight, does all of those things to the Picasso. The Van Gogh, someone took it home and was like, oh, well, I see a lot of people like in art museums that like put their art so that the sun can like hit the painting really nicely and I can see it. So I'm going to put it like where there's direct sunlight. And then like, oh, I'm going to dust it every day. Even though it's drying and curing, I'm going to just wipe it down every day just to make sure no dust collects on it. And like, oh, maybe if I just, move it a lot and like put it in an area where there's like wind blowing on it, it'll dry faster. That's you guys with your aftercare. You're doing all of this stuff that people are telling you to do online without doing the research of how do I take care of this piece of art? How do I take care of this to make sure that it dries and cures perfectly and then I can take care of it properly? That is the difference. And the purpose of the course, because these videos, like, this is why this is not just a straight answer. What massages do I need post-op? You need manual lymphatic drainage massage. There is that. You need that. Later down the line, 3 months, 6 months, whatever, can you do the other kinds of massages? Yes, but why are you doing them? And I talk about that in the course. Why are you doing body contouring? Why are you doing wood therapy? Why are you doing ultrasound cavitation? Why are you doing Brazilian lymphatics? What are these things for and when do we need them? All of that is addressed. But you do need manual lymphatic drainage, first off. And that's the purpose of the first 4 modules is why do we need this? And how do I take care of this? And how do I make sure this heals properly? Because your aftercare and your post-op massages is not, I'm going to say this so clearly into the mic, is not about shaping your body. Okay? You already had surgery. You already had the cut. You already got sculpted. You do not need to do any more sculpting. The painting is already made. You need to take care of it and let it set properly and let it heal properly. Manual lymphatic drainage is for the healing. So it heals properly without fibrosis, without a seroma, making sure that everything is in a contained healing space, that the swelling is getting taken care of the way it needs to, that tissue is being protected and taken care of so it heals. Not trying to force your body to heal like that Van Gogh where we're putting it in sunlight and putting a fan on it and trying to dust it and make sure that it like heals and cures properly. That's not the approach we need to be taking. You guys already had the surgery. You already had the cut with a tattoo, right? I get a tattoo. The ink's already there, okay? The skin's already broken. The ink's already there. I am not, in that first month to 2 months, going to take a Sharpie and try to keep coloring that in or try to make it heal faster. That is a surefire way to mess up a tattoo. It needs to heal properly. Now, there is something to be said. Whereas if they dug the needle too deep, if they didn't do the line work right, the lines are going to blow out. It's not going to heal right. Same thing with surgery, right? If we go to a surgeon that's doing things that like their technique is not the greatest and they're not really like an artist, or they are, it's just they're not really skilled in what they're doing, yes, your results may come out kind of weird, right? We know that. We've seen those pictures of people who heal where their tummy tuck scar is crooked. Like, I mean, like way off. Not just stretched from swelling and heals all like zigzaggy, but I mean crooked. That's a different story. But when you're talking about healing after surgery and you went to someone like Dr. Williams. You went to someone like Dr. Doback. You went to someone that's a big, name, and you've done your research and you've seen the results and you like them. You know you're going to an artist, a Van Gogh or a Picasso. Your job with your massages, the reason you need them is to make sure that Van Gogh or Picasso heals properly and sets right, because that is the work. The work is already done. Your work is now to make sure that the work that they did is protected and heals properly. And that is where your massages come in, because your massages are not meant to hurt. Your massages are not meant to have fluid leaving your body. Your massages post-op are meant to be helping your body heal, to protect your results and make sure they heal properly. All the work that surgeon did, we want to make sure that heals properly. That is the point of your massages, not to sculpt you, not to shape you, not to drain you of blood, not to do any of those things. The point of your massages is to make sure you heal properly without any fibrotic buildup, without any swelling getting trapped under your tissue. That is the point of your massages. And when you're talking about that, you're talking about manual lymphatic drainage. So, what massages do you need post-op? Well, manual lymphatic drainage to start, but you got to know what that is. You got to know how to find someone. You got to know all the things that come along with that, because when you're looking for someone to make sure that your results heal properly, you want to make sure that they're not on the brainwave of, I need to sculpt you out. You don't. Surgery was already done. You're already sculpted. It's just underneath all the swelling. The point of your lymphatic massages and your post-op massages is to get all of the stuff, all of the swelling, all of the excess stuff that's sitting on top of your results to heal and to come off of you so that you heal properly and all those results can come to the surface. Not taking a roller and trying to dig at your results, not squeezing blood out of you and trying to scrape my fingers into you to get your results. That's not how that works. Your body is already cut. It's already healing. All you're going to do is make a bigger cut, right? So if we have a cut on our hand, okay, if we cut our hand open and we stitch it, and then we think, oh, I want this to heal flat, so I'm going to push it down every single day so that it heals flat, and I'm going to rake through it. Yes, the stitches are on the top, but you have a hole under there that's trying to heal. Yes, it's closed on top, but underneath, you're trying to heal still. So by you doing that, all you're doing is continuing to break the tissue that's trying to heal, and then whatever fragile broken tissue is around it, and whatever tissue that hasn't fully healed on top. It's not how that works. What we want to do is make sure that we're getting the swelling out from in that tissue space, getting your body to absorb the swelling from that tissue space so that all of that heals flat and relaxed and nice and strong and healthy, not trying to dig into it or roll into it or put heat on it or do all these extra things. So again, your post-op massages are for cleaning up during the healing process, cleaning up all the swelling, cleaning up all the proteins, cleaning up all the fibrosis so that you heal properly with your results that are not covered by all of the swelling, fibrosis, all of those things. That is the point of your massages. Those are the massages you need, manual lymphatic drainage. Now, I offer virtuals. And 90% of the questions I get in my virtuals is, how do I find someone? What massages do I need? When do I get my massages? I am deathly afraid of squeeze massage. I don't want squeeze massage. What do I do? This is the point of the course. I am literally walking you through step by step. Because again, you will find a million answers on the internet as to post-op massage. You will call everyone in your area, and if you actually ask them what they're doing, you will get 10 different answers on lotions, rollers, mediums, cups, heat, CBD oil, all kinds of things. It's not about post-op massage. It's what massage do you need to heal after plastic surgery, and that's manual lymphatic drainage. And that's why, as you go through the course, I give you guys all the information. Because let's say you find someone, right? And that someone's not me. That someone's not as deep into this whole surgery world as I am. This someone isn't reading medical journals and making videos and breaking them down for you guys in plain English. That person is just a massage therapist. That person is just doing manual lymphatic drainage. You have to be the one to tell them. You have to be the one to say, I need the massage that is manual lymphatic drainage, Vater style, that is going to get the swelling out of my body. Here is what I've learned. Here's how the lymphatic system works. Now I know what you're supposed to be doing with your hands because now I know how the lymphatic system works, so I can make sure that you're doing the correct technique and the correct massage in the exact sequence in the right way so that I know the swelling is going to come off of me. That's what you guys should be doing. But nobody's giving you guys that research in plain English, except me. Now I am because we have the course. And then on top of that, you guys, no one else is talking about this anywhere. No other plastic surgery people are like, yeah, this is the massage you need. What you will hear sometimes is, yes, the massage is gentle. Yes, that's the massage you need is manual lymphatic drainage or lymphatic massage. But then they don't tell you what that is. They don't explain it to you. They don't give you guys the things and the tools to go find someone that properly does that. So module 6 is a bonus module, which is why I'm not talking about it much. We talk about fibrosis and how it's made and how to get rid of it and how to prevent it. Prevention is key when talking about fibrosis. Because that's the other reason you guys get your massages, right? Is because you have fibrosis. But if you don't understand it, you don't know what kind of massage to get. And then as a part of that is all these things that cause more swelling at home, like the heat and the ice and the rollers and the boards and the fajas that are too tight and all of the things that you see on the internet. And then all the things that actually do work for swelling, like the foams and the post-op cream and like all of the lymphatically inclined things that help move your swelling during your recovery. Because the reason you need your massages is to get that swelling off of you and you pee it out. If that's stagnating, it's not going to work, that it's going to continue to build up and you're going to continue to have swelling. So there are things that you are doing at home that could be causing that swelling to stagnate. And then your massages will help, but it won't be as powerful. So that's module 6. But there is a PDF upgrade that we offer. It is a Vetting Your Therapist question guide. We go over these questions in the course, but this guide has clickable links to the actual schools that certify therapists with full credentials to deal with swelling and lymphatics. And you can click on the directories, type in your zip code, and you'll get a list. And then you can use the vetting questions to call the people on that list to make sure you find someone in your area who is #1 state licensed. You cannot attend these schools if you are not state licensed to touch people. So massage therapist, occupational therapist, physical therapist, they have to be some kind of state license. And number 2, actually fully credentialed, not a 3-hour weekend course just to learn about what the lymphatics are, an actual fully certified therapist who knows the technique and knows the science the way that I do. So that's on that list. And then you can use the questions to make sure and ask them like, okay, are you doing it this way? Are you doing this? Are you doing that? What are you doing with my body? Have you had experience with plastic surgery? And on that sheet, I tell you guys what the answer should be to make sure that there's somebody who is actually doing the true hands-on VOD or MLD, not just saying they do lymphatic massage without any of the science or the backing of how swelling works. Because guys, us as manual lymphatic drainage therapists, like I said to start this video, we're not just doing this for post-surgery. That's kind of like a little bit of a red flag. And I say that with a grain of salt because there are some people like me who love doing this for post-surgery and just want to do that and just specialize in that. But I also work with people that have actual medical conditions with manual lymphatic drainage, with the swelling, heart failure, kidney failure, lymphedema after breast cancer, autoimmune diseases that cause inflammation, all of these different things that manual lymphatic drainage is used for, which is why when it comes to plastic surgery, I can explain to you guys all the medically inclined stuff and how this works, because it works the same way in the world regularly. So if you call someone and they're just doing this for post-op and they just did a 3-hour, 4-hour, 10, 15-hour weekend course, but don't really understand how swelling is working in the body, they're not going to be someone that's going to be able to tell you, okay, this might be where your swelling is coming from. Okay, this might be why it's taking so long to go away. Okay, maybe we should, do this with your diet instead, because they don't really understand how swelling works. They're not really a swelling specialist. The actual certified, full certification with letters after our name therapists that I teach you guys how to find with that vetting guide, they're swelling specialists. They know how swelling works. They know how swelling moves. They know how swelling's created. They know the anatomy, the science, the biology, the physiology of how all of this works to be able to look at you and look at your swelling and say, okay, yeah, I can reroute this. I know how this works. Not just, oh yeah, it's just stimulating the lymph. What does that mean? What does stimulating the lymph mean? How are you stimulating the lymph? What is the lymph? What do you mean? You guys are supposed to be informed about your body after surgery with recovery. It is supposed to be the type of thing where, like with me, you walk into my office, I ask you, tell me what's up, tell me what you need help with, we get you on the table, and as I'm working on you, I am explaining everything that is happening to your system, everything that could possibly be causing the swelling to stagnate, and everything we need to do to get it to get moving. That's what I do in that course. Not every therapist is going to do that, especially if they only have a weekend course certification. Our certifications are anywhere from 45 hours to 130 hours. It's a lot. So you want to make sure you're finding somebody that has all that background knowledge that you can ask questions to, because you are the one responsible for your recovery. You are the one responsible for communicating with your doctor, your surgeon, your therapist, and saying, hey, this is what's going on. Help me understand this. Hey, this is what I have happening. How do we, reverse it? Hey, I have a question about this. Hey, I got a question about that. What is that? They should be able to help you and tell you. Now, granted, we are not doctors. We are not surgeons. I cannot tell you why your stitch is ripping open. I can't tell you, if you're going to get an infection. I'm not your surgeon. I didn't do your surgery. I don't know. But what I can tell you as a swelling specialist is if you are doing things that are causing more swelling, it will put pressure on your incisions and may cause them to, open a little bit or be red or whatever. That's the perspective of the aftercare that you need. Your surgeon is not a swelling specialist. Your surgeon is going to say, oh, it'll go down in 6 months. Oh, the body will take care of it. Because yes, the body will take care of it. But if you keep having the swelling stagnate, your body is not going to take care of it the way that you feel like it should, and you're going to get frustrated with your recovery. You're going to go and look for massages because that's what you need, but it's not going to work. Or you're going to go get the massages, they're going to feel good, but then you're going to become fibrotic and hard. Or you're going to get the massages that claim to be lymphatic massage when you didn't actually know what lymphatics are, what your lymphatic system is, what lymphatic massage is. So you trusted someone that said they offered lymphatic massage, and you went and it didn't work, and then you say, oh, the lymphatic massage didn't work for me. That's because it wasn't real manual lymphatic drainage. It was just somebody saying lymphatic massage. Me. And this is why it's important for you guys to understand exactly what it is you're asking for. Because you will go into a surgeon's office and say, I want a skinny BBL. And they'll say, okay, yeah, we can do that. And a skinny BBL in their head is just shaping the outside, the top, and the bottom. Meanwhile, you're thinking it's a little bit of volume and projection. And then when they mark you up and you realize that your hips just got wider and rounder, but you didn't actually have any more projection, then you say the surgery didn't work, or it's not what you asked for, because you didn't know what you were asking for, which is why I do all these videos and why I have this course. Because when you call someplace and you ask for lymphatic massage and you don't know what you're asking for, they're just going to tell you whatever they're offering and whatever they're going to tell you, because that's what you're asking for. But if you're asking for Vater style manual lymphatic drainage, and you're asking for certain credentials, and you're asking for certain strokes and a certain technique done in a certain way, you're going to find what you're looking for. And you're going to know, and you're going to have confidence that it's going to work, and you're going to find someone who's on the same wavelength. But if you don't know what you're asking for, because you're doing TikTok and Instagram research, and not listening to somebody with credentials, but listening to the My Journey things, you're not going to find that, and then you're going to have a lot of swelling, and then you're going to be panicking down the rabbit hole, trying to figure out how to get rid of fibrosis, how to deal with swelling, doing all these things, buying all this stuff from Amazon, and it's not going to work, and you're going to be really frustrated, and then you guys find me panicking. So, what massages do I need post-op? You need manual lymphatic drainage. You need to know what that is. You need to understand what it is medically happening in your body. You need to understand what the massage is supposed to be doing to you. All the other kinds of massage can wait until you're 3 months, 6 months out. In my course, I explain everything about manual lymphatic drainage, why you need it, how to know if you're getting the right thing, how to know if it's a massage for swelling, when to start, when you no longer need it, what it's supposed to feel like, where to find someone, how to know that they're properly certified. I literally hold your hand step by step through the entire thing. Same way I do in all my videos. This is like 9 hours of content though. By the end, you will know exactly what you need, exactly when to start, exactly why you need it, and exactly how to find someone. And then I also explain all those tools and supplies that you're trying to use at home and why you would need them or why you don't need them. And then all the other kinds of massage and when you can do them and when you don't need to do them, or when you want to do them, or if you need to do them. We go over all of that in, I think it's module 4. We have a whole section on that. But it's not a straightforward answer. What massages do I need post-op? You need manual lymphatic drainage, but finding that, you guys need to know what that is. And I do have some videos on that. And like I said, I'm going to do a video, what is lymphatic drainage, so that you guys can understand it. But that course literally walks you through every single thing and holds your hand through the entire way. Because again, it's not what massages do I need. You need manual lymphatic drainage, yes, but all the other things serve a purpose, but not for now. And you don't need to be sculpted out. You don't need to be drained. You don't need any of these things. You guys are so terrified of it because it looks so painful and you're so scared of it, but you force yourself to do it anyway, and it's not necessary. It's not necessary. You need manual lymphatic drainage. I've said it like 5 times now. I'm going to say it again. You need Vater style manual lymphatic drainage after surgery. If you need to know what that is, how to find it, all of those things, the course is, I think we're going to put it in the description box. It's also in the link in our bio on our Instagram. It'll be in the link in our bio on our Spotify podcast places. It's everywhere. It's www.amarehealingarts.teachable.com. But the link's in all the places so you guys can go find it. But yeah, I hold your hand and teach you exactly what massages you need and when and why and how. Because those other things, the body contouring, the wood therapy, all of that does serve a purpose. Like cavitation, ultrasound, it serves a purpose, but not within those first 3 months of healing. So what massages you need when is a better way to put it. And to begin with, you need manual lymphatic drainage. And in order to find that actually medically inclined manual lymphatic drainage, you have to know what you're asking for and what you're looking for. And that's the purpose of our post-op Finding a Lymphatic Massage Therapist course. But yeah, you need manual lymphatic drainage. So very long answer to a short question. And that goes for lipo, BBL, tummy tuck, any surgery that's going to cause swelling. MLD is specifically designed to get rid of swelling. Again, not just from surgery, all kinds of swelling. But it works really, really great for surgery because the surgery, swelling was created during the surgery because of an injury, and that injury was the surgery. After that injury is done, that swelling is just swelling from surgery. It's just stagnant, dead, cold swelling that was being used to heal the tissue during surgery. So you shouldn't be re-swelling or getting more swelling. And if you are, it's because you're causing a swelling event, which we talk about, the swelling events that you guys cause during your recovery that's causing more of the swelling, which is why you need a bajillion massages, which you shouldn't. If you are getting proper MLD, you should not need a bajillion, gazillion, 6 months maintenance, once a month massages. That's not how they work. Once the swelling is gone, it's gone. You pee it out. So all of that is covered. We take a deep dive on that. But yes, this was just me giving you guys the information, giving you guys the perspective. When you are doing your research, please make sure you are doing it from a verified source, whether you're reading the medical journals, whether you're looking up things online. But if you need to know what kind of massages you need, why you need them, all of those things, that is the point of the course that I created for you guys. I walk you through all of it because I get comments on my videos. I get you guys messaging me, how do I find a therapist in my area? How do I know if they're doing the right thing? What kind of massages do I need? Should I start my massages now? All of that is in the course. So guys, it's Ashley with Amare. I will see you later. If you have questions, if you want to set up a virtual, if you are looking for post-op massage in New Jersey, Highland Park and Elizabeth is where I am located in Jersey. Call the office, 732-841-0142. Happy Alex will happily set you up with an appointment. And guys, this is the other thing. If you're calling me to set up a virtual and you have these questions, our virtuals are $135 for 45 minutes. The course right now, because it's going to go up soon, is $250 for 7 hours of content where I hold your hand and walk you through every single step of the massage process post-op. So that's the other reason I created it, is because we don't have enough time in our virtuals for me to explain all of the science and get really deep with you guys. It's me finding you a therapist, calling them, asking them the vetting questions myself, then you walk into the room and they're doing the exact opposite of what they told you and I on the phone, and I'm not there to tell them, hey, don't do that. You guys have to be your own advocate. Your recovery is your responsibility, and if you don't know enough about what massages you're supposed to be getting and what they're supposed to be doing for you, you can't be your own advocate, and then you're just at the whim of whatever's happening. And if you don't ask for the right thing, you're not going to get the right kind of massage post-op. So you need to know what you're asking for. So if you need foams for your fibrosis, if you need post-op cream for your fibrosis, if you need to learn how to sit on your BBL pillow and you need a BBL pillow, all of that is in our post-op shop. The link is in the bio in all the places, Amare, A-M-A-R-E, postopshop.com. And I think that's it. Yeah, that's pretty much it, guys. Thank you for joining me on this rant about the post-op massages. One last time, you need manual lymphatic drainage massage post-op Vater style. And if you have no idea what any of that means, check out the course, enroll in it, go through all the modules step by step, and you will know everything, and you will know exactly how to find a therapist. So, guys, I will see you soon. The next video I am doing is what is lymphatic drainage. I will do one video a week. It'll go up on the Spotify and the YouTube probably like over the weekends. if not Mondays. So I will see you guys soon. Have a great rest of your day. Ashley with Amare. Bye.